Part 2 of cardiology is going to cover blood flow and coronary circulation. Starting out looking at blood flow, there's a pathway of blood that your book in section 18.3 details the flow of blood, both the left and the right side. So I'm just going to cover some of that with you guys first today. So I'm going to cover it using the heart picture instead of the one that your book uses. So the first place we're going to go is number 1 here. This is the right atrium. So the right atrium receives the blood from the body. The blood will then flow through the tricuspid valve, and through the tricuspid valve it will then flow into the right ventricle. From the right ventricle it will pass through the pulmonary valve, so the semilunar valve, the pulmonary valve, and it will go into the pulmonary trunk. When it goes into the pulmonary trunk, it then bifurcates and splits into the 2 arteries, which we mentioned. So we have the left and the right pulmonary arteries. So where will they be taking the blood to? So they're going to be going towards the lungs. So when we have an artery that then moves towards a tissue, it starts to get smaller and smaller. So we see a smaller version of an artery called an arteriole. So I put this "-iole" on the end. It means a smaller version of it. And so once it passes through the arterioles, it will then reach the capillary bed. So remember, the capillaries are the small vessels, and this is where the gas exchange will take place. Okay, so then once the blood goes to the capillary beds and picks up picks up oxygen and exhales CO2, then it's going to come back through smaller veins called venules. So venules will bring the blood back towards the heart, where they will then merge to form the pulmonary veins. So remember the pulmonary veins right and left here. So right and left pulmonary veins will then bring the blood back into this structure, which was the left atrium. So from the left atrium, the blood passes through the mitral valve into the left ventricle. From the left ventricle, it then goes through the aortic valve into the aorta. Now when we get to the aorta, there's structures here that come off the top, or it can go straight down, and you see it passes behind and comes out the bottom here. This is going to be your thoracic aorta, which will then go down to form your lumbar, which will form your abdominal, and so on and so forth. So the flow of blood now is systemic. So same thing that we saw before. So we have aorta, which then branches into the arteries of the body, and the arteries will then branch into smaller arteries, which are called arterioles, just as we saw before. And then these arterioles will bring the blood into the capillary beds of the body, so the systemic capillary beds, where again now the oxygen will be leaving the bloodstream and going into the body tissue, and it will be picking up CO2. So it's the exact opposite flow of diffusive processes that happen in the lungs. From the capillary beds, then we will see the venules, which then merge into veins, which then merge into the IVC/SVC, and then we're back at the heart, starting where we were before, which was the right atrium. So those of you that are going into the nursing program, specifically here at FSCJ, this is one of the things that the nursing professors told me and other A&P professors, that our students don't know how to trace blood through the body. So this is one concept that is very important to know. So make sure you know blood flow through the heart and the body, because it's very important, and we'll actually go over it again with you guys who are going into those programs in our A&P boot camp Remember I said last show me that the heart does not use the blood that's going through it. It has its own circulation. It is technically the shortest circulation in the body because it comes out of the aorta here, goes to the heart tissue, and then turns around and goes right back in to blood flow. So it's a very short circuit. As you know, the size of the heart is roughly your fist. So it is it's the shortest path of blood through the body. It's delivered when the heart is relaxed, so the heart does go through kind of pulsations, which we know that the blood flow pulsates because we can feel that in our superficial arteries. Now, if we look at the overall supply of blood to the heart tissue, the left ventricle is going to be the one that receives most of the blood, the highest percentage of blood. And why do you think that the left ventricle receives the highest percentage of blood? We said something about it last show me that was important, and it had to do with the thickness of the wall. So what made the thickness of the wall higher for the left ventricle? It was because it had more muscle tissue. And remember that muscle tissue is going to need a high percentage or high amount of oxygen. So looking back at the originating points here, these are the right and the left. So this is the right and the left coronary arteries. So they emerge from the base of the aorta literally right after you see the aorta starting past the valve, the aortic valve. These two small branches are going to come out, and they are going to encircle the heart. So you see the left one comes down and splits, right one comes down this way. The branching of the arteries varies among individuals, but it's generally the same. Now, if you look back at these shaded portions, so you should see that the front side of the heart is very clear, whereas the back part back here is shaded. The shaded portion just means that it's trying to be three-dimensional, so it's going around, and you see it going behind here. So don't get confused by that. Now, when we see those two structures in the back, this one here and this one, this is called an anastomosis. Anastomosis. An anastomosis is a junction. So we already learned bifurcation was splitting. So anastomosis is kind of the opposite. It's where two vessels will join together. So you can see that the front side here and the back side will join there at this anastomosis, and the right side on the right and the left, will both join here. So these are two anastomoses, and it creates alternate flow, so it provides additional routes for blood delivery. However, if one of these vessels, say this one is blocked, it does not automatically mean, does not automatically mean that it can compensate for that blockage. So important to note these 5 arteries. The first one simply being the left coronary artery, the one that comes out on the left side, brings blood right past where the atria and the ventricle meet, and it splits off into numbers 2 and 3. So number 2 is called the anterior interventricular artery. Now in practice, this is often called the left anterior descending, LAD. So if you ever see the term LAD in practice, it's referring to the anterior interventricular artery here. This one is very important because it carries blood to the left ventricle. And we know that the left ventricle is important because it pumps blood to the whole body. And if we have blockage of this vessel here, it could impede blood flow to all of our body tissue. Okay, vessel number 3 here is the circumflex. So the circumflex artery is the one that goes around, kind of sits in the sulcus here, and goes around the heart to the backside. So it also supplies the left ventricle, but it's also going to go around supplying the atrium and also meet up this anastomosis in the back with number 5, which we'll get to in 1 second. So number 4 then is simply the right coronary artery. The right coronary artery. which emerges from the aorta and then comes down the sulcus here, where it will then take a turn around. When it turns around, it's now called the right marginal artery. And so each one of these is actually going to have a name as well, the smaller branches, but we're not going too deep into that. So these are the 5 major arteries that you should know for the heart. So these 3 veins that I've marked here are the 3 that I'm going to need you guys to remember. The first one is called the coronary sinus. The coronary sinus is going to actually bring the blood from the heart back to, so we see this little hole right here. This is going to be going back into the right atrium. So this hole will dump the blood that the heart used directly back into the right atrium. Number 2 is the great cardiac vein. So the great cardiac vein, which you see actually forms an anastomosis with number 3, which is on the posterior, the middle cardiac vein. So we're not calling them coronary now, we're calling the veins cardiac, which obviously is another word for heart. So these are the 3 major, and you also have the small cardiac vein, which is here. These are the 3 major veins that you need to be familiar with. So important imbalances of the heart tissue are going to be angina pectoris and myocardial infarction. So the first one, angina, is simply thoracic pain. Okay, so this is chest pain caused by deficiency of the heart tissue. So there is lowered oxygen delivery, okay, to the myocardium of the heart, which results in the tissue hurting. So that's pain. Whereas myocardial infarction, so literally muscle of the heart, remember infarct is an area of tissue death. So it is where there is decreased oxygen flow to the point where the tissue dies. Okay, so when you have a heart attack, myocardial infarction, typically you're going to have angina. So angina is a symptom of myocardial infarction, but not vice versa. So you can have chest pain due to fleeting or deficiency in blood delivery. That does not immediately mean you're having a heart attack. Now it could, so always be aware of the other signs of a heart attack. But with the myocardial infarction, the area of tissue death. So say you have a minor heart attack that you survive, because we know that people have heart attacks where they do not survive, they die. But tissue death may result. So when the heart tissue, the muscle dies, it is replaced with scar tissue. And scar tissue, last time I checked, does not contract. So obviously, if it does not contract, that's going to be harder for the heart. It's going to have to work harder. There are going to be other places of the heart tissue that have to pick up the slack. And that's going to create a problem maybe down the road, because if your heart is now having to work harder, it might lead to another heart attack if you're not changing your ways, or it could lead to congestive heart failure. So people who survive heart attacks need to be aware of further problems that could ensue, and also will always want to explore lifestyle changes. So what are some risk factors and lifestyle choices that people make that would lead to a higher incidence of a myocardial infarction? What do you guys think? Things such as diet. What do you think about smoking? How about obesity? Then you want to think about stress. What about age? Do you think that young people have heart attacks? It is possible, and as you guys will see in your discussion post, there are people in their 20s and 30s, and even younger sometimes, who have heart problems. But What do you think on average? Do you think that it's older people? If you're thinking past the age of 40, you're correct. What about sex-wise, male versus female? So this has often been debated. Do you think that females or males are higher? Now, it used to be females, but I think males are slowly catching up. What about genetics? People often say, oh, well, I have bad genes. If your mom and dad have a heart attack, are you truly predispositioned for it? Do you think that you can do some of these things over here, okay, to change what your predisposition might be? The answer is yes. Okay, this concludes part 2. I hope that you guys learned a lot in this particular Show Me.